Well, the province has been working to get people better connected with the healthcare they need, and that means bringing in more doctors to more communities across BC. But it could also mean integrating technology solutions. Not long ago, CBC heard from Victoria based physician Sarah Baldwin. Now, she has been on the verge of burnout because of the administrative weight of her practice. But then Sarah made some changes, and now she is advising other doctors on how to reduce their own loads through technology. Today, Sarah works as a physician and as an advisor to Cortico. That's an integrated patient engagement system. And she's been good enough to join us this morning. Sarah, good morning to you.
Hi, Stephen. Good morning. Thanks for having me.
Thanks for being with us. How are you doing these days?
I'm doing a lot better. Yeah, since since those changes were implemented, my family jokes and my friends joke that I'm not chained to my computer 24/7. So I actually get to spend my time off,
That's nice.
which is great. Yeah.
Now, you are a relatively young doctor. You're in your mid 30s. How surprised were
Mhm.
you by the amount of time that you were putting into admin work?
Yeah, I think we don't really get a full idea of it, and no one really tells us about it when we're training, when we're in medical school and residency. But I found out pretty quickly. I think within my first month, I was pretty bright eyed and bushy tailed coming out of residency, very excited to start working. And I just noticed that I was staying later and later at the office, and I actually started waking up at 5:30 in the morning,
Hmm.
just to get a hold on my inbox and all my administrative work. And it was very overwhelming and very discouraging because I went to medical school to be a doctor, and I didn't realize how many inefficiencies and administrative work I would actually be doing in my day-to-day job.
And were you running your own practice at the time?
So I started off working in a walk-in clinic, actually in Burnaby called Kensington,
Yeah.
and then I struck out on my own, and that's I think when I really started to see how much work it was because my MOA would go on vacation, and I would be doing her job, my job, and chasing down faxes, calling pharmacies,
Oh,
all these things
gosh.
that happen behind the scenes that people don't realize doctors do. And I was happy to do it. I felt that I noticed I was spending about 30 hours a week on administrative tasks. And doing the math, I realized that was equivalent to 3 full days in clinic.
Wow.
And I could have been seeing, 90 to 100 patients in that time. So yeah, it's not the patient care that burns us out. I don't think it's knowing that your time is being wasted when people are waiting for care. And that was really upsetting for me.
And so tell me how you have managed to deal with this. What did you discover?
So what I ended up doing was I decided to measure where all my time was going. And I tested these Canadian-based automation tools like Cortico and another one from Ontario called Wave the Wait. And they integrate into our medical record system, and they automate a lot of the basic day-to-day admin repetitive tasks that eat up our staff time, like booking and intake and results and messaging.
Yeah.
And it was astounding. Within a few weeks, we were doing the math. We were saving 18 to 20 hours between me and my MOA. And our error rate dropped as well because things were automated and we weren't fueled by caffeine, late hours trying to put things in the computer. So I could actually finish my day on time, and my MOA was not burnt out,
Wow.
which was amazing. So it showed me that I don't think burnout with doctors is inevitable. I think a lot of it is based on design and how the system is designed at the moment.
Now, in the medical profession, of course, you have to manage a lot of sensitive and intimate patient information. Were there any privacy concerns at all when it comes to relying on a third-party technology to help manage that information?
It's a good question, and I definitely felt it was really important to do the research on the tools I was using to make sure they were HIPAA compliant. But what actually was really enlightening for me, as I've worked for Cortico as an advisor and I've looked into different tools, is there's very strict privacy and security standards that have to be met by these companies. So that's compliance with these different protocols. All of it's fully encrypted, hosted on Canadian servers. So there's actually a lot more effort, I think, that goes into privacy than patients realize. And these companies can't really run without those certifications. So it actually made me feel a lot more confident using these tools. And the reality is the tools we use right now, which is fax,
Hmm.
which is in my mind in the 1980s technology.
That's
If
still
I'm not
hard for
wrong.
me to believe.
I know. It's amazing that we use fax for virtually almost all communication, whether it be pharmacies, we
Yeah.
send faxes to the hospital. I think that's more insecure because you type in the wrong number on your fax machine. Who
Yeah.
knows where that document, I mean, not to alarm the public, but I think the electronic ways to track things, I feel a lot better about it than faxing.
Yeah. I just take
So
pictures of stuff on my phone and then send it in.
exactly. So yeah, I think the security and privacy element I'm actually more confident about with the electronic methods rather
Yeah.
than the faxing.
And what about potential job losses? I mean, obviously this has not replaced your MOA, your medical office assistant.
Hmm. Right. So my MOA and I are actually really good friends. I think we've bonded together over our long nights
Yeah.
of admin work. It's a great question. I completely understand why people worry about that. I think in reality, it's not about replacing people. It's about removing the pointless, repetitive parts of their jobs. Because my MOA, Miranda, she does her job because she loves talking to people and interacting with people in the clinic in real life. So if she's taken away from that work, her, it doesn't really make sense for her, right? And the patient care suffers when MOAs are constantly trying to do all these little admin tasks all the time.
Yeah.
So yeah, I think her work has actually become more meaningful. I think if I tried to take these tools away, she would probably quit.
All right, Dr. Baldwin, it's really good to hear you this morning. Thank you so much for
Yeah,
taking the time with us. And I'm so glad you're doing better.
thank you. Yes,
Uh,
thanks so much for having
All
me.
right, you take care. Bye bye.
Okay, bye-bye.
That's Dr. Sarah Baldwin, Victoria based GP with a focused practice on skin conditions and therapeutic pain management, now using some technology tools to cope with burnout or to not burn out at all, I suppose.